Examination of posterior instability, which is a more rare instability of the shoulder, is better done with a patient laying down in a comfortable position. And that way you have complete control of their arm. And you want to put your thumb on the anterior head of the humerus and try and drive it posteriorly. And usually you feel a shucking or a moving of that humeral head posteriorly on the glenoid. An alternative position for the apprehension test is with the patient in a lying position. Again, we bring the arm into abduction and start to externally rotate and watch the patient's face for any apprehension. Now, Dr. Jobe came up with a special test which goes along with this test called the Jobe relocation test. And that's where you put your hand on the anterior humerus and do the same test and see if the patient is more comfortable. Now, the patient is more comfortable because you're preventing an anterior dislocation by pushing them into a relocated position. A somewhat uncommon injury of the shoulder in athletes is called a slap tear, and that stands for superior labrum anterior to posterior. It's a very difficult examination and very difficult diagnosis to make. There are 1 or 2 physical findings of a slap injury. One is a deep popping in the shoulder and deep pain in the glenohumeral joint. The second is called O'Brien's test. O'Brien's test is a test where we put the arm a little bit across the body with the palm up, and we ask the patient in that position to push towards the ceiling. In this position, the biceps is facing straight towards the ceiling because the position of the humeral head. If we then turn the palm over, the biceps is now towards the center of the shoulder joint. We have them push up there, and they may feel a pop. The superior labrum is the area of origin of the biceps. Therefore, if it is supported and anatomically in an advantageous position, the patient won't have pain with palm up. But if we sublux it into the joint and have them push, they'll have pain with the palm in a